Judge Clay Jenkins just stepped up to the mic. Scott, sorry for the interruption. Let's listen in.
The Commissioner's Court will extend these orders by rule. The orders end 7 days after the first order, so those would end on Friday, but they will be extended. And let me kind of go through the highlights of that, and rather than reading you the entire order, if in fact someone sent the highlights. So the biggest parts of this order, and I'll go through it, but the biggest parts of the order are: we now distinguish between community gatherings and recreational gatherings. So a community gathering is everything that it's been before, and a recreational gathering is a gathering that is primarily for a social purpose. Examples of this would be a backyard barbecue, a social event, a pickup basketball game, or other gatherings similar to that. For recreational gatherings, the limit will now be 10 persons or fewer. For community gatherings, it will remain at 50 persons. We are suspending all delivery hour restrictions for the supply chain for groceries and for medical supplies. This is trucks going to the warehouse and trucks coming through your neighborhood to go to the grocery store. Those trucks will be running at any hour they need to keep our stores and hospitals stocked. I have asked the justices of the peace to suspend all evictions of any type and all writs of possession for at least the next 60 days to prevent renters from being displaced and to prevent the potential spread of COVID-19. We can ill afford to have people couch surfing or homeless at a time when the safest way to keep us all safe is for people to limit their trips out of their homes. And to do that, they have to have a home. And we can't have people bunched up moving from place to place. We are clarifying our order so that it is clear that all gyms in Dallas County are to close. We are making minor changes to clarify for golf courses and outdoor other outdoor courts like tennis courts that in the county and in the country clubs and private clubs, there may be, cities could do something different, but in the counties they can do something more restrictive but not less under my order. Those will be open, but the amenities inside your country clubs will be limited to 10 people. The bars and restaurants are already closed. The card room and other amenities are limited to 10 people or fewer. I think that covers the vast majority of the things in the new order. And rather than reading the entire thing to you as we've done in the past, it's the same order with the big change being 10 for recreational gatherings, and you will be hearing trucks in your neighborhoods, and evictions will be halted. With that, and Dr. Huang would normally read you all about social distancing, and that has not changed from the last two times that we did this either. So with that, we'll take your questions.
Judge, any frustration with the state for not enacting these same measures statewide?
I just got off a call with Governor Abbott where I was able to speak to the governor about this. I think the governor is catching up to where you've seen the counties of Dallas and Bexar and Travis and El Paso and Harris lead. And I've encouraged him to look at the orders from those 5 counties that have led this state in this crisis, and to pass something that's uniform. I sent him a letter 2 days ago laying that out, and I think tomorrow he will do that. I believe what the governor will do tomorrow is follow the science and pass guidelines that will be in keeping with the CDC. I've asked that in doing that, he allows the autonomy to happen in cities and counties so that they can do things that are more restrictive if their situation warrants. For instance, in Dallas County, we don't have the numbers for tomorrow, but it will be exponentially more than today, just as today was more than yesterday. So we are seeing a rapid community spread, and we have to act aggressively. There may be other places in the state who choose to act a little less aggressively. So, for instance, his order may not stop evictions. That is not something that is yet in the CDC guidelines, but that is something that jurisdictions on the East and West Coast that are seeing, they're about 3 weeks ahead of us in this outbreak, are seeing needs to happen to control community spread. So I've asked him to do that, and I believe that he will do that. And then the last thing that I've asked, and I believe he's considering, is as those CDC guidelines change, and they will change, that he will quickly, in a matter of hours, as Dallas County did. Dallas County heard from the NIH, CDC, and President Trump, and less than 3 hours later, about 2.5 hours later, enacted every thing that they asked the governors and states with community spread to act. And so that when those change, I've asked that he be ready to enact those swiftly, because we don't have hours, much less days, to wait on these things. So I am heartened by that. What else?
How do you enforce the restrictions, and have you had to yet?
So, people have been great. We have had to, in a couple of instances, send officers out to remind people. But I think most people, bar owners and whatnot, have really stepped up, and restaurant owners have stepped up in that regard. Now, as we move to these social restrictions, I need your help, people of Dallas County, in enforcing those. If you see a gathering, the social gathering of 10 or more, please call 211 and report that, because we don't have the officers to drive through alleys and listen for loud parties. But we do want to ask people to do that. So I think two things will help with the social gathering. One is just the need to protect the community, and the shame that would come on someone who, at a time when we are in an unprecedented community that endangers the health of all of us, that would disobey the law in order to have a party with their friends. And two, we will be using our officers, and that is punishable by a fine or a jail sentence of up to 6 months. So that's how that will work.
What charge would that be? Just to
in violation of the orders, I'm not sure. I think that's a Class B misdemeanor. I'm not positive, but it's punishable, whatever 6 months is.
How long do you plan to ask the county commissioners to extend these orders?
For 30 days, from Friday.
Why 30 days? I mean, we've seen other places go 2 months.
We're doing 30 days, or as long as Governor Abbott's disaster declaration, it extends. You want some good news? Anybody wanting good news? Okay, here's some good news. So good news is I received a call 3 hours ago from someone at the Emergency Operations Center for the Department of Homeland Security, and our trucks will be arriving sometime tonight or early in the morning, so that we will we will have the Roche kits that we have been trying to get, so we can open up our 2 pod sites. I'll ask the City of Dallas and the Dallas County Homeland Security and Emergency Management to work throughout the evening and the day tomorrow to get the logistics ready. I'll ask a team at Parkland and Dallas County Health and Human Services to work around the clock to get that done as well. And I do appreciate people are working around the clock, and I do appreciate that.
So when would you expect those to open?
Well, I may have that information that I could tweet out or something by your 10 o'clock newscast. I don't know. I need to assemble my team on that.
We have more cases now, or we have cases with younger people, the Dallas ISD student, some cases yesterday, people in their 20s and 30s in critical condition, no underlying condition, a teenager in the cases today. that news has really alarmed people. And I know White House Coronavirus Task Force was talking today about how this might impact younger people more than we first expected. Can you talk about that?
Sure. So it may be more than the White House first expected, but this is a bad virus, okay? On the youngest, healthiest person, it is twice as deadly as the flu in the rosiest predictions that are out there. But you know, so many people, it's a game of roulette, right? A bunch of young people get together and they all get COVID-19. Some of them may have very mild symptoms. Some of them may be asymptomatic, and one or two of them may be in an ICU unit. So, you know, this affects people across the board. What we know is when we look at what happened in China and Italy and the information coming out of there, if you're the current stats are that if you have an underlying heart condition, it has a near 10% mortality rate, and if you're over 80, it's around 15%. It's a lower mortality rate for a person that is, say, 30 or 20, but it leads to pneumonia in a significant population, percentage of the population that gets it, and nobody wants to get pneumonia, and you know, it leads to severe respiratory distress.
Is it possible for you or Dr. Wong to explain the difference between why 10 for recreational gatherings versus 50 for community gatherings? Is there a way to explain why those two numbers need to be different in your view?
Yeah, so I will tell you that less is better, okay? And you know, just honestly, I've lost a lot of sleep, done a lot of praying, talked to a lot of doctors about this. I'm not at the point where I'm going to tell a family at this point which one of them can't go to their loved one's funeral, okay? Just not there yet, okay? But we may get there. So, what else?
Dr. Wong, you had said earlier that you were frustrated that other counties weren't on board to the same degree that Dallas County has been. And now we're seeing that Tarrant County, they had a press conference today. Talk about how much of a bearing what other counties and neighboring counties are doing has on Dallas County. I know a lot of people traverse back and forth. So why was that so critical, and why were you so frustrated about that?
Well, and I mean, just following on what the judge said, you know, it's the people who go to neighboring counties, then many of them live here, come back home. So if these policies, you know, aren't affecting the whole region, then we, you know, because the principle is to increase that social distancing to have people not be exposed to these situations where they can transfer that infection. And so if it's not sort of in the whole area, we know people will go to other places. They will be more likely to get that exposure and then come back. And so it's in all of our interests, I think, to have these policies that are protective.
Can we talk about testing and what's the latest number of how many tests we can do a day, and whether you guys are getting help from commercial labs and doctors ordering? I don't know if they are having a hard time having back order or if they're able to get these tests.
Phil, you want to take that?
You know, and it's been actually 2 weeks now since we first stood up our lab at the county health department, and you know, shortly after then some of the commercial labs came on board also. So, you know, we've been working through getting these new lab equipment on board, getting all the reagents, getting these positive controls. We are now things are sort of more at a steady state for us, so we can process 160 tests per day in our DCHHS laboratory. But what we've said, you know, we're using those for public health purposes, for critical decisions, a lot of situations, if there are first responders, if there are healthcare workers, who are getting that test in a rapid turnaround, allows us to get that information so that these people don't have to be furloughed for 14 days, those sort of critical information. You know, there are limitations to the numbers that we have. We've said that the larger capacity is really going to be increased with the commercial labs. And so that is what, you know, there is much more availability for those tests, but we're trying to make them available for critical situations where the decisions are important for public health purposes, for getting healthcare workers back to the job, for first responders, those sort of situations.
On that note, Dr. Wong,
And can I add one thing on that? So the commercial labs are doing the most tests right now already in Dallas County. And I would venture to guess that by the time we get the 2 pods running, which is 5,000 tests a week once they're both running, you'll still have more commercial tests happening in the hospital systems than even those 2 pods and us combined. So you're seeing a shift away from it just being the county lab to being more and more of the commercials. Go ahead.
Dr. Vaughn, me and my colleagues say we've been talking to folks who have symptoms that have not been able to get tests. Not only in Dallas County, Collin County, I know you can't speak to all the other counties, but in Dallas County, can you talk about the confusion and just among like private doctors and hospitals? Even, we try to call the hotline today and the volunteer on the phone just didn't have answers to some of our questions, like where to get a free test. Can you talk about the stream of information and bottom line, someone who has symptoms, what should they be thinking about today as far as getting a test is concerned?
So one of the things, in terms of getting tests, we're trying to work with healthcare providers. Many of the private healthcare providers, hospitals, have some of these commercial lab availability. We're trying to fill in the gaps.
Clearly, we've had the signal freeze up. Apologies for that, but we've been listening in over at Dallas County on a number of new provisions that have been put into place tonight. And if you missed the top of this, because this has been going on now for 17 minutes, before we take a quick break, let me bring you up to speed if you joined us a little bit late here. Actually, I understand that the health director is back up and speaking, so let's go listen in one more time.
Infection. To be determined that they are cleared of the infection and then can go out. So what that does, open up some possibilities. If we don't have the test, if someone's suspecting that they have it, they can go home, self-isolate. And so those criteria, they're now on the CDC website. It's 3 days after resolution of fever without any fever-reducing medications and improvement in respiratory symptoms with at least 7 days passing since onset of symptoms. So that's new information guidance, which at least gives some information that if someone isn't able to be tested but they develop these symptoms, they self-isolate. If after they meet that criteria of resolution of symptoms, then they are okay to go out. So that's helpful, I think. Because because there are still limitations on testing.
So let's take 2 more questions. We have a lot of work to do.
What's being done to make sure that we have enough hospital beds in Dallas County, ventilators, respirators, personal protective equipment for hospital workers that our hospitals
You want me to take it? Okay. So there aren't enough respirators, as I've said before, there are not enough respirators in the world. There are not enough in Dallas County if we don't all act with personal responsibility. We're doing everything that we can to get respirators. We're fortunate, and ventilators and PPEs and all the things you talked about. We're fortunate that in this county we have a lot of Tier 1 big hospital systems. So we're set on that for the near term. And as you may have seen. And I believe this country needs to do it, and that's one of the things I'm writing letters about too. We need to change our manufacturing to start making more ventilators. The ventilator companies in America right now, it takes them, I think, 44 minutes to make one ventilator. So in foreign countries that are already seeing this, they're turning their automobile plants and other plants into capacity to make ventilators. We can do this in America. I'm working with the distilleries and we'll sign a contract soon to have a local distillery switch their production into hand sanitizer from fine spirits. And then that hand sanitizer will be delivered to us in 55-gallon drums, and we'll put that into spray bottles for our first responders and our healthcare workers because we have a critical shortage there. I've asked construction industry and others that have N95 masks to please consider giving some of your inventory to Dallas County Health and Human Services for use by our medical community. We're doing everything that we can to keep up that supply chain, and people are reporting on that, and the information is understandably scary to people, okay? But as we've said before, It's not a time for panic, it's a time for personal responsibility. And it's not a time for fear, it's a time for faith, and faith also in the science, which manifests itself in those CDC guidelines, these control orders, but also the CDC guidelines for your family or your business. And it's time for us to move from being selfish, especially when we go to the grocery store, folks. You don't need to get every frickin' roll of toilet paper at the grocery store. We're making more toilet paper, okay? People send me pictures of the grocery stores. We got to move from selfishness to sacrifice. That means leave some for your neighbor. By the way, the grocery stores, I have frequent calls with the supply chain, and they're doing a tremendous job. And they're telling me that if we can just modify the behavior of people to not be hoarders, that there's nothing wrong with our supply chain. Now, on these medical things that Allison asked about, we do have supply chain challenges, and I'm not going to lie about that. And those are national challenges. We're a little ahead of some other places, but not by much. And as we've said before, my fear is that COVID-19 will be worse in Dallas County and in North Texas than in most of the places in the United States. For the underlying fact, I've told you we have to act quickly for two facts. One is we have community spread that's beginning to be massively expanding community spread. But two is every other place in America that has faced this so far has what's called Medicaid expansion, so that there's health care coverage and people are going to the doctor who make $14 and $15 an hour. We don't have that in Texas. We have 250,000 people in our workforce who have no health coverage because we don't have that. And because of that, you got people leaving their house every day, going to their workplace, and if they just have a runny nose and a cough, they can't afford a doctor visit. Those folks, it's not their fault, but they will be a vector. It's not their fault that they don't have health coverage. It is frankly the state's fault, but it's not their fault. And because we have so many of those people, more people don't have coverage because of that Medicaid expansion decision in North Texas than in any other metro area in the United States. Because of that, we are in a uniquely bad situation, and we've got to act aggressively, all of us, everyone, personal responsibility for everyone, if we're going to come out of this with as few casualties as possible.
Could I add one thing in terms of just, the goals of the order, the goals of the social distancing are really to slow the spread of this. And one of the key things we're trying to do is the healthcare system. And, you've seen the flattening the curve so that it actually decreases that really spike in demand for all these type of hospital equipment and things that you're talking about. So that's why this is so important, because it can slow that spread and help protect our healthcare system too.
And let me say something on masks too, since it seems like everybody and their dog has like a stash of masks now at your house. So the mask won't do you any good when you go out to take a walk in the park, but here's where the mask will actually help all of us. If you have symptoms of a cold, or if you're going to be tested for COVID and you've got a stash of masks, please wear that mask, because me wearing a mask won't keep the germs, if they come through the air, from getting to me. But if I were sick, me wearing a mask, and if I sneeze and cough into it, it goes in the mask and not into the air. That actually does work. So if you're sick, wear the mask. If you're not sick, the mask really does you no good.
So, Judge, we've seen your order be amended twice in less than a week. Is it going to get worse? I mean, do you see us getting to a place of, shelter in place?
It's going to get worse, Nick, before it gets better. Okay, and I don't want to sugarcoat that. And if we, we're not New York City, all right. In New York City, there's not backyards, there's not neighborhoods, it's just a different place. It's a wonderful place, but a different place. We're not at a place where we need to shelter in place through order. I will tell you, every interaction that you have carries with it some risk, all right? So what I would say is, if you need to go to work to feed your family and to pay your rent, then that's a risk you have to assess and go to. If you need to go to the grocery store to get groceries to feed your family, those grocery stores will be open and make the trip. But think about how to do that with personal responsibility. Can you go to the grocery store? Those of you who have the disposable income to do this, can you go to the grocery store one time when you've been going 3 or 4 times? But leaving enough for your neighbor and abiding by some sense of sacrifice. Can you make the decision as employers and even as workers, okay, and even as workers, can you make the decision to telecommute and let your people telecommute? Really, the only reason you should be leaving your house at this point is to go take a walk with 6 foot of separation or jog or whatever, to go to the grocery store, to go to the doctor, to go to work. But even choosing to go...
All right, everyone, we're running out of time here on CBS 11 on the air, so we're going to push this live news conference with Dallas County Judge Clay Jenkins over to the website immediately, cbsdfw.com. We're streaming it live. We'll have it there. But the takeaway from all of this afternoon from Dallas County in the last half hour, recreational gathering, think basketball game, backyard barbecue, things like that, that is now limited to 10 people or less. Deliveries to grocery stores and other medical facilities, things like that. Expect to see big rig trucks through the middle of the night. Expect to see them, expect to hear them. They've released restrictions on that. And also, if you are a renter in Dallas County, suspension of all evictions now for the next 60 days. A lot is changing quickly. We're here to keep you informed.